You're watching CTOM TV. Knowledge is power.
So they're saying there are no FDA-approved therapies for this type of cancer apart from what they are prescribing. So the FDA has two different approval processes. So they have an FDA-approved drug. And so that drug is approved for a specific mutation. But an approved indication or approved therapy is only for a specific stage, grade, and prior treatment basis of a certain cancer.
Hey, tricky.
Tricky. So
I didn't know
FDA-approved
that. You didn't tell me
therapies.
that.
Yes.
That wasn't in the
So,
data.
well, an FDA-approved therapy is specific to the stage. It's specific to what type of treatments you've already had, and it's specific to the grade and the type, and what you've responded to, what you haven't responded to. So yes, that's a very, very fine criteria to get an FDA-approved drug. However, an FDA-approved drug that is targeted for a certain mutation can be used off-label.
Mm-hmm. Right. So you've got, from the oncologist perspective, or at least what they're sharing with you, you've got maybe two options. But if we're thinking bigger picture in terms of
FDA-approved drugs.
yes, all the possible FDA-approved targeted therapies or immunotherapies out there. There are many.
Yeah.
So again, once you know your molecular features with the tumor DNA sequencing or inherited mutations testing or all those other things Alex talked about, then you would be able to see, whoa, look at all the possibilities.
So once again, you approach this question by asking for clarity. So you say to them, are you referring to FDA-approved drugs that would be potentially beneficial for me in an off-label situation? Or are you referring to FDA-approved indications? And an indication, as I mentioned, has a background to it,
Mm-hmm.
Based on the grade. So it's important to understand that approval is based on a cancer that has the highest percentage of that mutation. Mm-hmm. So when they do a clinical trial and a drug testing and an approval, that mutation may occur in many different types of cancers, and it may benefit many different types of cancers. Mm-hmm. But typically the approval is based on the cancer that has the highest amount of that mutation. So if you have a new drug and it targets a BRAF mutation, and you see that melanoma has a really high percentage of having this mutation, whereas lung cancer has a much lower chance of having this, but there's a lot more lung cancer patients than melanoma patients, the drug company is going to need to say, okay, we need 500 patients for this trial, 1,000 patients for this trial. How are we going to find 500 BRAF positive lung cancer patients? We know we can get 500 BRAF positive melanoma patients because it occurs in a much higher rate. So let's go for the melanoma. The drug may be more beneficial in the lung cancer, but they're going to go with the drug that has the highest sellability, or the cancer that has the highest sellability. Many drugs start out in this manner. And we have so many different drugs that I couldn't even go over them. There's so many different cases where a drug will be started for one indication, and then they'll find that, hey, patients with that same mutation that have this type of cancer also respond to that drug. And patients that have this type of cancer may also respond to the drug. So in the eyes of an oncologist, that doesn't matter, because the drug therapy or indication is for one type of cancer. So even if this drug works incredibly well in lung cancers and you have a lung cancer, they're not going to consider that, and they're not going to tell you about that because it is considered off-label, even though it is an FDA-approved drug. So once again, that gets back to the clarity. What are you saying? Are you including off-label? Are you including clinical trials? Are you specifying indication, stage, grade? You have to really clarify what they're saying when they're saying that.
Mm-hmm. Right, which is why understanding what you were talking about at the top of the hour, all the possible things,
yes,
they
the
could
diagnostic criteria.
Yeah,
yes.
When you understand that, or at least have the list handy,
yes,
then you can just run through that list. Is what you're telling me right now
based on these diagnostic factors?
Yeah.
So take that list of diagnostic factors and tests, take it to your oncologist, and with every question they or every answer they give you, say, How does that question relate in regards to point A, point B, point C, point D, point E, MSI, all these different diagnostic tests.
Thank you for watching Ketome TV. Subscribe below and stay informed.